Hi there, this is Dr. Jenny Yoon. Today we're going to continue our series on vitamins. We're going to talk about vitamin D. Vitamin D is produced when the UV rays from the sunlight strike the skin and trigger vitamin D production in the body. Cholesterol is converted by this UV exposure to a precursor form of vitamin D. This inert precursor then undergoes conversion by the liver and kidney to its active form that we call 1,25-hydroxy-vitamin D. The main function of vitamin D is to increase calcium absorption from the intestines and maintain a balance of blood levels of calcium and phosphate concentrations. This delicate balance of calcium and phosphate levels in blood is extremely important in ensuring normal mineralization of bone, bone growth, and bone remodeling. Contrary to what most people think, the bone continually remodels itself to keep itself strong. This delicate balance requires that it has all the minerals it needs. Without sufficient vitamin D to regulate the levels of calcium and phosphorus, body starts absorbing these minerals from the bone, which will weaken the bone. It's interesting to note that at least 50% of adults in the United States lack sufficient levels of vitamin D. About 42% of our teens are also vitamin D deficient. Foods that contain a significant amount of vitamin D include salmon, cod liver oil, mushrooms, canned fish. Vitamin D fortified milk provides relatively small amount of vitamin D per cup. 15 minutes of sunlight exposure to arms and legs can produce much more vitamin D than what we can ingest. So how do we measure our vitamin D level? It's a blood test. A normal level of vitamin D is greater than 32 nanograms per milliliter. We call vitamin D deficient if the level is less than 20. Vitamin D deficiency increases bone turnover, resulting in diseases like rickets, osteomalacia, osteoporosis. It's also associated with muscle weakness, muscle aches, symptoms very similar to fibromyalgia. Risk factors for vitamin D deficiency include age greater than 65, people who have pigmented skin like African Americans and Asians and Latinos, body mass index greater than 30 kilogram per square meter, insufficient sun exposure, use of medications such as seizure medicines and steroids. Those who have had bariatric surgery like gastric stapling and bypass, or have kidney or liver disease, or are malnourished are also at risk. A recent study showed that vitamin D deficiency rate was the highest among Hispanic and Black women. In a recent study of about 100 young women who are still menstruating and have breast cancer, 74% had vitamin D deficiency. Breast cancer survivors are especially at risk for osteoporosis because some of the treatments for the cancer causes these women to lose estrogen. Low estrogen level can cause bone loss leading to osteoporosis. So the current treatment guideline for breast cancer survivors include measuring bone density in women who are on medications that put them at increased risk for osteoporosis, and if they are osteoporotic, then we put them on medicine to treat that. And in addition to regulating calcium metabolism, vitamin D also modulates immune responses and controls normal cell growth. Vitamin D deficiency has been associated, therefore, with increased risks of prostate, colon, and breast cancer. Vitamin D also affects heart cells and cells that line blood vessels. There's some data that suggests that high doses of vitamin D therapy can protect women from breast cancer, but this is preliminary and we need to do more studies. In summary, vitamin D is important for maintaining strong bones and may play a role in development of certain cancers such as breast, prostate, and colon. A new study also suggests that adequate vitamin D and calcium intake can protect against skin cancers. This is Dr. Jenny Yoon. See you next time.